It's time to revise. Hey guys, let's do some AQA Psych paper 3. Let's do some schizophrenia. Why not? Token economy today. Let's do it. There you go. You've got some exam questions there. There's your chance to pause the video, give it a go, whether you're planning them, whether you're trying them all, whether you're just going to do the essay, whether you're going to talk through them with a friend. Up to you. But do something active with it and come back when you're ready for me to talk through. Okay, right. One method sometimes used is token economy. What's meant by a token economy? Right, nice, straightforward. It's only 2 marks. We're not going to go as far as talking about like classical conditioning or operant conditioning or anything like that. We can just give a very straightforward overview, which is something along the lines of, it's a way of managing schizophrenia patients that involves identifying and selectively rewarding desirable behaviours. Patients can then swap the tokens for rewards. Done. That's all you need for 2 marks. We then need to look at a 4 marker. So how are we going to expand this for a bigger question? So you're going to say basically what I've just said, but let's talk a bit more about how it works. So we're going to identify some target behaviours, which might be getting themselves dressed properly, or it might be engaging in a conversation, anything like that, but you could give an example to elaborate there. So we're going to identify some target behaviours. We're going to pair the tokens with rewarding stimuli. So we'll talk more about this maybe in the application question in a sec, but what you could do is just give people tokens and start to associate those with the rewards. So before you actually reward them for a behavior, you could just say, oh, we're going to have a new system here where you're going to get 5 tokens a week or a day or whatever, and you can go to the shop and swap them. Okay, so they make that link. Okay, so we've made a link, we've paired it, that's classical conditioning. So the tokens have now become secondary reinforcers. Yeah, the primary reinforcer would be the food, the snacks, the film, whatever it is. The secondary reinforcer is the tokens. Naturally, they don't, have any value. Yeah, that's why we've paired them. They're a secondary reinforcer, is the terminology to use. All right. So now the patients are engaging in these target behaviours. Yeah, what we need to do is spot that and give them a token every time it happens. Yeah, as quickly as possible. Right. They've got the tokens. They then have a chance to trade them. Okay, so you have maybe a site or a shop or something there where they can go and they can exchange the token for whatever reward it is that they want. And again, you could give an example, maybe snacks, films, rights to kind of wander about if that's appropriate, whatever it might be. Okay, so you could talk about classical conditioning being involved in the pairing of the token with the reward initially, so when it becomes a secondary reinforcer. And then every time you're giving them the token, when they do the behaviour, that could be the operant conditioning part of it. Okay? All right, bit of application now to look at. So, psychologists, we're going into a ward. We're asking staff what they think about what's going on. One member of staff says, it's tough to see how the patients would cope on the outside. It takes ages getting them up, washed and dressed. I'm not sure they'd be able to do it without us. Okay, all right. A couple of ideas hopefully going on in your mind there. Second quote, it takes a lot of effort, to get them to clear up after meals. It'd be great if you could help us to do something about that. All right. So that tells you about possibly some target behaviours, doesn't it? Yeah. So in this question, 6 marks, knowledge and application, you're going to talk about what a token economy is, but you're going to do it in such a way as to get across to the examiner that, this is how the psychologist would do it. So we're going to have kind of knowledge and application embedded together. So the psychologist initially would identify some desirable behaviours to target. These might be, judging from the quotes from the staff, patients getting up on time, patients getting washed themselves, patients getting dressed by themselves or dressed appropriately, or whatever's appropriate for them, to be honest. If they need support, fine. But some kind of appropriate behaviour around washing and dressing would be a good target behaviour. In terms of the second quote, another target behaviour might be that patients maybe take their plate away, or they're probably not expected to go and like wash it all up and everything because they'll likely have kitchen staff in many of these situations. But taking their plate to an appropriate place would be good, or clearing their leftovers into an appropriate place would be a possible behaviour you could target. So there's your application in terms of desirable behaviours. We're then going to say that the psychologist is going to train the hospital staff on this token economy system, and we're going to set up a shop or a kind of exchange point where these patients could swap these tokens for a reward, and you could give a couple of examples of reward. We're going to say that the tokens need to be paired with the rewards, and then you're going to do a bit more application, because then you're going to say every time the patients get dressed appropriately, get washed appropriately, every time, at meal times, the hospital staff need to be on the lookout for patients that are clearing up appropriately and give them the tokens straight away. Okay. Then, after they've earned the tokens for XYZ, patients can then go to the shop. Okay. That last part is probably less important, because this is more about how we're implementing the token economy, but I would still mention it because it's an important part. Okay. All right. We're now on to some evaluation. We're going to discuss the strength of token economies. So, as I've done in my other videos, if you've watched any of those, when I'm discussing a strength, what I would tend to do is kind of a peel style paragraph about the strength, but then I would kind of say, is it really a strength? Is there kind of a counter argument to this? And maybe bring it back together. Yeah, that's how I see discuss a strength or discuss a limitation. Yeah. So, what is the strength of token economies? Possibly one of the strengths is that there's research support. Yeah. So, studies have shown that the number of desirable behaviours, or the number of positive behaviours, whatever, does significantly increase following the implementation of a token economy. There aren't any key studies or anything, so I think something like that is fine, or you can use what you know. So there's research support. This suggests, so the kind of the end bit of this suggests that token economies are an effective way of managing schizophrenia. Fine. To discuss this, we could then take that a bit further and say, despite the research support, and this is where you're going to counter argue. So I think a couple of options. You could counter with the idea that actually a lot of the research isn't very well controlled. There's a lack of random allocation, there's a lack of maybe long-term follow-up, something along those lines, and then bring it back together at the end and say something like, this undermines the support provided for token economies, yeah? Meaning that it's maybe not as an effective method as it seemed at first glance, or something like that. So that's option one. Option two might be that despite the research support, and there's very little evidence or very little kind of indication that any of these desirable behaviours would be continuing if and when patients kind of returned to families or left the hospital ward setting. Okay, so despite it being an effective way of managing schizophrenia, it's not a particularly effective way of treating the condition. There's no long-term benefit to patients. To be honest, some people believe that it's actually more useful for the staff, which I guess could be an ethical discussion. Okay, that's that one. Right, this time we've got an 8 marker, we've got outline and evaluate the use of token economy. So it's straightforward enough. We've talked through the knowledge already. You've got that cycle of kind of, establishing some behaviours, pairing the tokens, giving the tokens, and allowing that exchange, okay? And it reinforces itself because every time you give the tokens, you're strengthening that link, aren't you? Okay, so we've got the knowledge, we've been through that. In terms of how to tackle the evaluation marks, I tend to do 2 evaluation points for an 8 marker. You could do a strength and a limitation. We've already talked about a strength, there's research support. A limitation, again, I've kind of mentioned that already. You could talk about the lack of long-term benefit, kind of a lack of utility outside the hospital. It's not going to benefit patients. There's not going to be that kind of maintenance of these positive behaviour changes. You could talk about the lack of kind of quality research support if you wanted to. So I think there's plenty there already for an 8 marker. Okay. So what we want to do there is, for the 16 marker now, outline token economy. So again, 6 marks of knowledge. I'm not going to go through that again. But instead of evaluating it for the 10 marks, we're comparing it with another psychological treatment for schizophrenia. So your 2 options there to compare it with would be CBT or family therapy. You can pick. But it is only one, so don't then branch off into anything else, okay? So for 10 comparison marks, I'd probably be looking at maybe 3 paragraphs of similarities and differences, possibly a 4th, but I'd probably just do 3. So what can you compare them on? You can compare them in terms of how effective or appropriate they are, or how ethical they are. You could compare them in terms of your knowledge as well about how they actually work, but I'm tempted to, just because I think that's my preference really, I'm tempted to use more kind of discussion or kind of evaluative themes like ethics and effectiveness and appropriateness and stuff like that, okay? So in terms of comparison, we could, let's do CBT, for example. So, one difference between token economy and CBT is, the involvement or how active it is for the patient. Token economy is a very passive process where they just receive tokens and the learning kind of happens because, that's what behaviorism is, isn't it? It's quite passive. There's no active processing going on there. Whereas, try and use that comparative language to all of these comparison paragraphs. Whereas CBT is an active process that requires motivation and requires the patient to actively reflect and engage in the therapy, okay? And I guess take some kind of responsibility for their behaviour and for trying out some of the strategies that are covered in CBT sessions. Yeah, so you could have a discussion there about the difference in terms of how active or how responsible the patient is for their own improvement. You could have a discussion about research support. So you could say, there's maybe little evidence for the long-term effectiveness of token economy, whereas for CBT, there's a lot more research supporting it. What else could you talk about? You could talk about maybe the utility or how useful these things are. For a third point, you could talk about how token economy is only useful or only possible with patients in a more kind of controlled setting like a hospital ward. Whereas for CBT, then you could talk about how it can be accessed by the vast majority of patients because it doesn't matter if they're in a hospital ward or at home or by themselves or with a family or assisted living or whatever. They can access it, and CBT can even be done online, can't it? Yeah? It would be difficult to see how you could do token economy online. Okay, so that's another discussion paragraph. I guess then if you wanted a fourth point, what would I do? I guess you could talk about how neither of them is kind of a complete treatment or a complete cure for schizophrenia. That would be a similarity then as well to give it a bit of balance. You could talk about how token economy would be used possibly, yes, we said on a hospital ward, but possibly with patients that are already taking antipsychotic medication. Yeah, so it'd be like an add-on to help manage them. Similarly with CBT, often with schizophrenia, because, think about the symptoms, because of how severe some of that could be, you often don't find CBT being used as a sole treatment, or that can be. Often you'll find that, again, people are already taking antipsychotic medication, and actually a lot of patients need to be stabilised on that medication so that they can engage with CBT because, think about it, they need that kind of clarity of thinking, they need a bit more of that kind of self-awareness, that sense of reality, and that hopefully, bit of trust with the therapist as well. And as you know, paranoia is sometimes seen in schizophrenia patients. Okay, right, so hopefully that's given you plenty of ideas, but it's comparison there, not evaluation of token economy. Okay, so how did that go for you? As always, it's important to reflect. Why did that happen? And so what? What are you going to do about it? How is it going to feed in? I say what are you going to do about it. It could also be what do you not need to do now? Yeah? Look at it both ways. Right, okay, that's it for that one. That was me discussing, what was I discussing? Token economies for schizophrenia. Okay, I hope that was useful for you. Let me know how you're getting on. And I'll see you in another video. Cheers, guys. Keep it up.